Hello, everyone. A very good evening and a very warm welcome to Facebook Live channel of Continue Our Kids. And I guess we are catching up after some time. And I'm Dr. Himani, a developmental pediatrician. And let us take up some questions which have come up in our previous sessions asked by parents directly. Today, we are going to try and answer those questions for you so that you get an answer for your queries that you have in mind. Let us start with our question and answer session today. So let's have our first question here.
Chanika Dumka is asking, my child is 11 years old, but उसका main problem है कि किसी चीज में interest नहीं लगता. Academic time पर वही problem है, attention span नहीं है. Mostly वो eyes close करके खुद ही बोलती है.
Right. So here the child is 11 years old. The first problem that the parent has is an attention problem, and second is ke eyes close karke khud hi bolna, self talking. So the first thing is important here for us to know that the child, whether the child is on autism spectrum or the child has only ADHD kind of for diagnosis. So diagnosis is very important. So having a detailed diagnosis for the child will help us to identify why this inattention is there. If the inattention is secondary to ADHD, then it can be very well managed with some amount of medication, pharmacotherapy, because we have medications which can treat symptoms of ADHD. And but if it is associated with autism, where the self talking is meaningless or purposeless, and the child is very inattentive, not being able to learn, and there is some amount of developmental delay or lag also that we are observing, then we need to probably use some intervention strategies wherein we build the focus, we get the child's attention, we work on the child's attention, we work on their language and communication, where their language becomes much more purposeful and meaningful, so that they talking to themselves, and whatever conversation they have, that is more purposeful and meaningful and with others. That is how we can address this condition in both scenarios.
Alright, Mitko Daily is asking, मैंने 6 months से oral stimulation दे रही हूँ. खाने से पहले वाइब्रेटिंग ब्रश, मसाज, बेबी ब्रश सब दे रही हूँ, बट अभी चूइंग ठीक से डेवलप नहीं हुआ है. कितना दिन लगेगा फॉर पूरा चूइंग आने के लिए?
Yeah. So, Mitku, it's very important here to know the age of your child. What is the age of your child? If your child is very young, then oral stimulation, जब आप कर रहे हैं उनका oral stimulation, so सिर्फ oral stimulation, एक chew tube या एक massage is not the only thing. There are many more methods which you need to try. बिकॉज कभी कभी बिहेवियर भी होता है बच्चे का कि मुझे वो खाना उसी पर्टिकुलर फॉर्म में चाहिए, टेक्सचर में चाहिए, टेस्ट में चाहिए, देन ओनली आई विल कंज्यूम. इफ इट इज नॉट गिवन टू मी इन दैट पर्टिकुलर फॉर्म, देन आई विल नॉट ईट और विल नॉट च्यू. सो आप ये भी ऑब्जर्व करिए कि क्या आपका बच्चा चॉकलेट का बाइट खा लेता है चबा के, या चिप्स का एक बाइट, या कुरकुरे, या French fries, कोई भी ऐसा item which is probably a junk food, and if you give that to your child, if the child is able to chew that, इसका मतलब उनका chewing mechanism ठीक है and it is working. It is not like कि बच्चा chew नहीं कर सकता है. So ये आपको observe करना है. Along with oromotor, there is a lot of uh, things that we need to take into consideration, whether it is a sensory reason why the child is not eating, chewing, sight of food, smell of food, texture of food, color of food. What is it that the child is not liking? One reason. The second is oromotor stimulation exercises are a lot of various types. There can be a change of exercise, desensitization to the food items which the child has never tried. मतलब जो उसने कभी खाया नहीं है पहले, वो आइटम उसके सामने एवरी डे रख के बच्चे को डिसेंसिटाइज करना है टू द फूड आइटम, सो दैट ग्रेजुअली जस्ट चाइल्ड स्टार्ट्स एक्सेप्टिंग दैट फूड आइटम सेंसरीली. ये इंपॉर्टेंट है हमारे लिए ऑब्जर्व करना. एंड व्हेन वी टेक इनटू कंसिडरेशन ऑल अदर थिंग्स, फिजिकल भी हमें चेक करना चाहिए कि ओरल कैविटी ठीक है, मुंह में कोई छाले तो नहीं है, कोई डेंटल कैरीज तो नहीं है, कोई पेनफुल टूथ तो नहीं है जिसके कारण बच्चा च्यू नहीं करना चाह रहा है. दीज फिजिकल रीजंस मस्ट ऑल्सो बी रूल्ड आउट बिफोर वी कंसिडर दैट हम ओरोमोटर कर रहे हैं, बट अगर हम जबरदस्ती उसको पकड़ के ओरोमोटर कर रहे हैं, मसाजेस, बेबी क्राइंग, हाउलिंग, फीलिंग स्ट्रेस्ड अप, एंड अंदर छाले हो गए हैं इसके कारण, छिल गया है मुंह उसके कारण, दैट काइंड ऑफ एन ओरोमोटर विल नॉट हेल्प विद chewing. So it has to be done in a way where the child is happily accepting the massages and is happily accepting the food item, new food item. ये मेथड आपको ट्राई करना है.
राजू देशमुख इज आस्किंग, मेरा बच्चा 3 साल का है और उसको जेनेटिक ऑटिज्म है, उसके पास बिल्कुल स्पीच नहीं है। मैम, क्या जेनेटिक ऑटिज्म ठीक हो सकता है?
Okay, Raju, this is a very important question because lot of times autism can be secondary to some genetic cause or genetic association. And we all know we don't still have in science any genetic treatment which can actually rectify the genetic problem that is being observed. हमारे पास अभी जेनेटिक ट्रीटमेंट नहीं है कि हम जीन्स को मॉडिफाई कर सकें. सो जो जीन्स के कारण या उस पर्टिकुलर जेनेटिक डिसऑर्डर या रीजन के अंदर जो जो चैलेंजेस ऑब्जर्व किए जाते हैं, वो चैलेंजेस बच्चे के अंदर रहेंगे एंड दे कैन कंटिन्यू टू स्टे. हाउएवर, the positive thing is that we should still continue to stimulate the child because बच्चा अभी सिर्फ 3 साल का है. And 3 years, we still have a lot of time. The speech center still has time to myelinate completely. तो जितना आप stimulation करेंगे, there is the possibility the child may start speaking up with the environmental stimulation. It can happen in genetic causes that the child may be delayed in all developmental domains and they gradually start learning. They may be running a few years behind the other children who are typically developing, but they do acquire milestones a little later though, but they do. So you shouldn't lose hope so soon. You should continue with the stimulation.
कुमार समाव इज आस्किंग, मैम मेरे बच्चे 20 दिन से पानी नहीं पी रहा है, सिर्फ दूध और लस्सी पी रहा है, ही इज ऑटिस्टिक, अब क्या करूं?
ओके, सो ऑटिस्टिक सिम्टम जो होता है उसमें कुमार, यू हैव टू अंडरस्टैंड दैट बच्चों के अंदर रिस्ट्रिक्टेड पैटर्न ऑफ इंटरेस्ट बिहेवियर हो सकता है. ये एक सिम्टम होता है उनका. रिस्ट्रिक्टेड पैटर्न का मतलब होता है कि एक पर्टिकुलर आइटम को सिलेक्ट कर लेना, स्टिकिंग ऑन टू दैट आइटम. तो लिक्विड्स में उन्होंने एक पर्टिकुलर चीज को सिलेक्ट करके उसको रिस्ट्रिक्टेड बना लिया कि मुझे यही खाना है, ऐसे ही खाना है, इसी कलर का होना चाहिए, इसी टेस्ट का होना चाहिए, इसी स्मेल का होना चाहिए. एंड द मोमेंट यू ऑफर अ डिफरेंट फूड आइटम और अ थिंग समथिंग which is different from that restricted choice of theirs, they will not accept. So what you can do here is आप gradually धीरे धीरे करके उनको every day जो है वो वाटर एक्सपोज करना है. आपको पानी, आपको, because the child has to drink. If his all his liquid requirement that the child has या थर्स्ट का जो उनका रिक्वायरमेंट है वो अगर दूध से या लस्सी से ही पूरा हो जाएगा तो वो पानी मांगेंगे नहीं. दूध या लस्सी आप दिन में 2 बार कर सकते हैं एंड बाकी टाइम यू ऑफर द चाइल्ड वाटर इन डिफरेंट फॉर्म. समटाइम्स अगर वो वाटर नहीं पी रहे हैं तो आप उनको कभी सिपर में दे दें, कभी कोई अट्रैक्टिव यूटेंसिल में दे दें, कभी डिफरेंट डिफरेंट मेथड्स यू कैन. छोटी ग्लास में दे दें, कोई जो साउंड वाली ग्लास होती है उसमें दे दें, कोई रीइंफोर्समेंट दे के दे दें, क्योंकि 1 या 2 बार वो शुरू में हिचकिचाएंगे बिकॉज इट्स अ ट्रांजिशन फॉर देम. एक एक्टिविटी से दूसरे एक्टिविटी में, एक चॉइस से दूसरे चॉइस में ट्रांजिशन करना है. बट एक बार उन्होंने 1 या 2 बार उसको सक्सेसफुली अचीव कर लिया तो फिर वो उसको एक्सेप्ट कर लेते हैं चेंज को. पर आपको ट्राई करना पड़ेगा कंसिस्टेंटली एटलीस्ट फॉर 7 days विद पॉजिटिव री एंड नॉट पुशिंग और फोर्सिंग द चाइल्ड कि तुम पियो 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 पानी. पुश नहीं करना है, पॉजिटिवली करना है आपको. अगर उसने 1 चम्मच भी पिया है तो यू हैव टू रीइंफोर्स इट. दैट मेथड यू कैन यूज. या.
Gayatri is asking, my son is 6.9 years. In class, he copies the board, but if the teacher says anything, or any activity going on, he stays in his own world. Why does he not pay attention when people are talking? Is it because of his lack of understanding, or could there be auditory processing issues along with that? Can you talk about it just like this one? Thanks again.
Okay, so Gayatri, what we would know would want to know here is one, the age of the child, and the second, that whether again the child has ADHD or ASD. In both the situation, there is a possibility that the child is not paying enough attention when the child is given a command in a group setting. So especially in children on autism, if you give a command, if a teacher is giving a command one on one, they would be receptive. Similarly, in ADHD children also, if the command is given by getting their attention, if the teacher taps on them, gets their attention, and then gives a command, there is a good possibility that the child has paid attention, listened to the command, and then is able to process obviously the information and executed. If it is also their level of understanding, comprehension कितना है बच्चे का, ये बहुत important है. जो हम बोल रहे हैं क्या वो बच्चे को समझ आता है, उतना लेवल है उनका लैंग्वेज अंडरस्टैंडिंग का, वो important है. अगर if the child is understanding whatever command we are giving, and usually he understand that quality of language, then obviously it is an attention problem. But if the child is not understanding the language only that we are saying, या उस level का language उनको comprehend नहीं करते हैं, वो understand नहीं करते हैं, तो उनको वो command one on one भी नहीं समझ में आएगा, despite getting their attention. So what we need to do is first know their language level, what is their language comprehension level. Second, we need to know, is that an attention problem? And third, in both autism and ADHD, both the diagnosis, the child may require some amount of physical prompt to get their attention towards the teacher in a group setting. They may not be able to be that focused in a group setting. So these things we need to keep in mind and try these accommodations maybe in class. Help the child with better language comprehension, and then see if things are working out or not.
प्रतिमा शुक्ला is asking, मैम बच्चा क्लास में सिट नहीं करता है, क्या करे?
Okay. So Pratima, again, if the child is not sitting in the class, maybe the child is hyperactive, maybe the child is not understanding what is going on in the classroom. अगर क्लास में जो भी एक्टिविटी हो रही है, जो इंस्ट्रक्शन दी जा रही है, अगर वो बच्चा देख नहीं रहा है, उसे समझ नहीं आ रहा है, या वो पार्टिसिपेट नहीं कर पा रहा है, तो बच्चा इंटरेस्ट लूज कर जाता है, एंड द चाइल्ड विल देन बी रोमिंग अराउंड, वुड नॉट वांट टू सिट. Second, if the child is very hyperactive and the child cannot sit in one place, has poor sitting tolerance. थर्ड है, अगर इनअटेंटिव है, बहुत अटेंशन स्पैन कम है, तो भी बच्चा ध्यान नहीं दे पाएगा कि क्लास में क्या चल रहा है, एंड दे टेंड टू लूज देयर अटेंशन एंड देन दे वांट टू रोम अराउंड बिकॉज देन द होल सिनेरियो बिकम्स वेरी बोरिंग फॉर देम. सो ये सभी सिचुएशंस में अगर अटेंशन स्पैन कम है, तो हमको we can take help from our occupational therapy who can do certain activities to work at reducing hyperactivity, to building executive skills, sitting tolerance, command following, instruction taking. We can also do some activities at home, like every day आप एक टारगेटेड टाइम पे, फिक्स्ड शेड्यूल्ड टाइम पे हाफ एन आवर का स्लॉट रखिए, जहां यू विल सिट विद द चाइल्ड एंड यू विल स्टार्ट डूइंग सम एक्टिविटी एवरी डे. First day he may sit for 5 to 7 minutes only, and the second day maybe you will be able to sustain again for next 5 7 minutes. 7 days में थोड़ा उनका routine बनना शुरू होगा. Gradually by the end of a month you may be able to help the child sit for full 30 minutes. But initially don't give up, you have to be consistent with this. And if you are consistent and you keep activities which interest the child, then the child will be motivated. आपके साथ काम करने के लिए उसको इंटरेस्ट रहेगा, वो मोटिवेटेड रहेगा और करेगा सब एक्टिविटीज. धीरे धीरे करके आप इस सिटिंग टाइम को इंक्रीज कर सकते हैं. एक फिजिकल एक्टिविटी पार्क टाइम बच्चे के लिए जरूर चाहिए. उनको पार्क में हर दिन लेके जाना है, ताकि उनकी एनर्जी जो है वो सही ढंग से सही जगह पे चैनलाइज हो. इन प्लेइंग, रनिंग, साइकिलिंग, क्लाइंबिंग, जंपिंग, ये सब एक्टिविटीज वो पार्क में, गार्डन में करके आए, तो वो थकेंगे, उनकी एनर्जी चैनलाइज होगी. उसके बाद जब आप उनको बिठाएंगे कुछ करने के लिए, दे विल बी एबल टू sit for some time and be able to pay some attention towards whatever you are trying to do. You can try these methods.
Megha Agarwal is asking, My child does not want to eat any fruit. He feels pukish on seeing any cut fruit. He can have juices but not raw fruits.
Yeah. Megha, this is a problem which is very common for children who have sensory issues and restrictions about the food. What happens is they're so fixated at drinking the juice that the sight of food, the smell of the fruit item, or the change in the text, the style in which it is offered to them, that whole scenario is very, very distressing for the child, and the child does not want to even look towards that food item. So here we need to start desensitization. आप एक ही fruit लीजिए, don't give too many fruits at the same time. Just pick one fruit that he's having in the juice form, जिसका taste उनको पसंद है और जिसका smell उनको पता है. They are used to comfortable with that taste and that smell. Pick that fruit item and the first day probably आप फ्रूट को कट करेंगे और दूर रखेंगे, बहुत पास नहीं रखेंगे, बच्चे के सामने लाके नहीं रखेंगे. Keep it a little far off for 1 week. If the child is really very, very difficult in eating fruit, keep the same fruit for 1 week in cut form at a distance. So gradually the child will start getting used to the sight of that cut fruit every day. ये desensitize कर रहे हैं हमको, हम उनको transition में help कर रहे हैं. Second day, maybe reduce the distance, keep it a little closer, let him get used to that. Even the smell of the fruit, if it is causing that pukish sensation for the child will start getting desensitization sensitized to that particular smell also. Gradually then you can start eating that fruit in front of the child without the child offering the child to eat, without pushing forcing your child to eat it. And once the child is not in a threatened position, the next time the child may try to explore it by touching. अगर वो खुद नहीं टच कर रहा है तो आप उनको थोड़ा सा टच करा सकते हैं, धीरे धीरे उनके हाथ में रखना शुरू कीजिए एंड फ्रॉम हाथ से धीरे धीरे उनको टंग पे टच कराइए, लिप्स पे टच कराइए, टंग पे टच कराइए, and maybe in a month or 2 months you will be able to start with one fruit. And if you are able to start with one fruit, you can apply the same technique to desensitize the other fruit items and then expose. Again, consistency in this is extremely important, because desensitized तभी होंगे जब उनको हर दिन वो sensory input मिलेगा. धीरे धीरे वो used to हो जाएंगे and they'll not get disturbed to it. You can try this, but you have to go slow in this. अगर आप बहुत जल्दी करने की कोशिश करेंगे तो भी बच्चा डिस्टर्ब होकर डिसरप्ट कर देता है. स्लोली जाइए.
Rana Singh is asking, I need your suggestions regarding my son who has ASD. He is going to regular school. He's in LKG, having strength of 40 children, but in his class, teacher send him to special education class for 1 hour, and after that he go back to his class where normal kids are with him. Ma'am, is it okay or not? I really need your suggestion. Please guide me.
Okay. So, Rana, it's very important here that we understand that the child on autism spectrum requires some amount of one-on-one stimulation, individual learning. They learn better in one-on-one setting. They do not learn that well in a class of 40 students, because they sometimes sensory tend to get lost unless the child is making is made to sit just next to the teacher can continuously prompt that child as to this has to be done, take out your notebook. In a class of 40 students, one teacher may not be able to constantly be able to prompt to your child, because she has other 39 children also in the class. And a special educator in that 1 hour in one-on-one setting will be able to teach and help the child cover up a lot of stuff where the child is lacking behind, because here the child is given 1:1 attention and they learn better, they understand better, and their attention can be taken, grabbed again and again while teaching them. So it's not it's absolutely fine if your child is going for an hour for a special education class. I'm sure it is going to help the child learn better and stay at par with the other bunch of children in his class. Yeah.
Uh, Arya and Arush are asking, मेरा बेटा 3 years का है, उसे ऑटिज्म है, अंडरस्टैंडिंग में इम्प्रूवमेंट स्लोली हो रही है, बट वो अजीब-अजीब आवाज़ निकालता है और बोलता नहीं है। ओनली मम्मा बोलता है, वो भी मीनिंगफुल नहीं है। नहीं, क्या वो बोलेगा मैम?
Okay, again, Meera, your child is only 3 years old. You don't lose hope so soon. At least the child is able to speak mama, and taking out sounds is again a good sign. The child wants to vocalize. The child is trying to take out those sounds and is wanting to vocalize more. So the child, there is a full scope that the child, if stimulated well, will be able to say words. आप बिहेवियर मॉडिफिकेशन थेरेपी लीजिए, स्पीच लैंग्वेज थेरेपिस्ट के साथ लाइन अप कीजिए बच्चे को, एवरी डे सर्टन अमाउंट ऑफ स्टिमुलेशन, ओरोमोटर एक्सरसाइजेस थोड़ा थोड़ा कर सकते हैं स्टार्ट, but not vigorous and rigorous oromotor, because I have come across parents who do so rigorous oromotor that it becomes painful for the child, and that stimulation then is not something that we are looking at. It is just that we want to sensorily make the child aware of these muscles here, that they can be used for chewing, they can be used for speaking. Your tongue can move in different directions, you can produce sounds through your lips, through the movement of your tongue. ये orientation करनी है बच्चे को, उठा के सब घुमाना नहीं है, राइट? सो हमें ये सब का कॉम्बिनेशन करना है. टेक हेल्प फ्रॉम प्रोफेशनल्स बिकॉज दे आर ट्रेन्ड टू डू इट इन द राइट वे, and keep stimulating your child. Your child is just 3 years. Don't lose hope, especially if a child is saying even one word not meaningfully. It's okay, but he can produce that sound as mama. That means these sound, the child has speech, some speech, and so you can just work a little more with the therapies, and I'm sure you will find results with that.
Shabranti De is asking, Beta is going to be 3 years on 17th September, but he's not interested in talking. He has been given speech therapy, but when we call him by his name, he cannot understand where the sound came from. We uh, we bid him if he make Jannat sound, but no, he sleep too much as per age. He does not chew the food, just swallow.
Okay, how old is this child, have they mentioned?
3 years.
3 years. Okay. He's going to be 3 years and he's not interested in talking. Okay. You've given speech therapy also, but he does not seem to. When the child is not responding to the name, one important thing we must keep in mind, and maybe get the child evaluated, is that is the child able to hear everything properly? Hearing is a very important sensory system which has to be intact when we are trying to work on the language. So make sure all those children who are not speaking, who are not acquiring speech, their auditory system is functional, they can hear, they do not have a hearing problem. That is something that we must rule out first. The second thing here is that the child is small, is not chewing, could be habitual. आप क्या स्क्रीन देख के उसको खाना खिला रहे हैं तो उसको बिल्कुल भी आइडिया नहीं होगा कि मेरे साथ मैं क्या खा रहा हूँ, उसका टेस्ट कैसा है, उसका स्मेल कैसा है, जस्ट स्वॉलो करना है, स्वॉलो करना है, स्वॉलो करना है। च्यूइंग नहीं आएगी उस सिनेरियो में। अगर आप उनको टीवी पे डिस्ट्रैक्ट करके सभी मील्स खिलाते हैं, थिंकिंग दैट बिना टीवी के तो ये खाएगा नहीं। तो ये प्रैक्टिस एक तो आपको रिड्यूस करना पड़ेगा और बंद करना पड़ेगा इवेंचुअली। The third thing is that you need to start talking to your child. Show and tell them everything which is around, whatever you're doing, from morning waking up, changing their diapers. Talk to them. We have got picked up a fresh diaper. This is a dirty diaper. We are going to throw it in bin. मतलब जब आप बातें करेंगे, आप बच्चे को डिस्क्राइब करो हर एक्टिविटी जो आप कर रहे हो, बेथिंग, ब्रशिंग, डायपर चेंज, eating, because these words are being heard, and when they are hearing it again and again and again every day, they start associating those words. At least उनका receptive language आ जाएगा, मतलब understanding of the words, understanding of language. ये हमारा प्री लिंग्विस्टिक स्किल है कि लैंग्वेज आने के पहले भी कुछ स्किल्स होना चाहिए बच्चे के अंदर। वो स्किल्स नहीं होगा तो लैंग्वेज कैसे आएगा? और उसमें से सबसे इंपॉर्टेंट है लैंग्वेज को अंडरस्टैंड करना। सो रिसेप्टिव लैंग्वेज जो हम बोल रहे हैं, हमारा इंस्ट्रक्शन, कमांड, वर्ड काउंट, क्या बच्चा समझ रहा है कि इसको बुक बोला है, इसको मम्मा ने बैग बोला है। इफ यू हैव सेड गेट योर शूज, उसको शूज समझ में आ रहे हैं। गेट गेट योर रेड कार, तो उसको क्या कार समझ में आ रही है या रेड समझ में आ रहा है? सो ये कॉम्प्रिहेंशन और understanding of language is very important. सेकंड इंपॉर्टेंट थिंग इज कि क्या बच्चा कॉपी करता है हमारे एक्शंस को, हमें देख रहा है. इफ वी आर टचिंग आवर नोज, इफ यू आर क्लैपिंग और इफ यू आर टचिंग आवर हेड, इज द चाइल्ड कॉपिंग आवर एक्शन? इमिटेशन, ये भी एक बहुत इंपॉर्टेंट प्री लिंग्विस्टिक स्किल है विच हैज टू बी देयर. सो ये सब एरियाज में आप काम करना शुरू कीजिए. देयर इज अ लॉट ऑफ टाइम योर चाइल्ड विल स्पीक. स्टार्ट विद प्री लिंग्विस्टिक वर्ड काउंट उनका रिसेप्टिवली बढ़ाना और एक हियरिंग स्क्रीनिंग करना टू मेक श्योर दैट हियरिंग इज ऑल राइट.
Now we will be answering some of the questions our viewers have asked us on the comments. Swapna Das has asked, ma'am, my 4.2
Yeah.
years old mild ASD son, though understands everything and follows commands before, but from the last 2 to 3 weeks he becomes adamant and is in cool voice, does not follow commands. He cannot write spelling too,
Mhm.
spelling, identify shapes, color, etc. Can speak but does not reply and repeat when asked. He is restless too. Please suggest, ma'am, how to control restlessness and become verbal.
Okay, so Swapna, your child is 4.2 years old on autism and is following some basic commands and has some receptive language as well. But for last 3 weeks, he has become adamant and he doesn't follow commands. So here we need to see what is the change that we have made in our teaching pattern, or is there change in the way the child is taught? Is there a change of a teacher, a change of a class, school, person, any kind of a change? Has the child been sick or is suffering from some kind of a viral episode? In those situations, the child sometimes does not want to work additionally. So we need to keep all those things into consideration कि कोई medical issue तो नहीं है which has caused an additional challenge for the child or additional amount of दिक्कत बच्चे के लिए अगर बढ़ गई है किसी और कारण के कारण, तब भी बच्चा फोकस नहीं करता, टेंशन नहीं देता है, गिव अप कर देता है जल्दी एंड डज नॉट वांट टू वर्क. सो इंस्ट्रक्शंस नहीं फॉलो करता, टेम्पर टैंट्रम्स नहीं थ्रो करने लगता है. दूसरा एक होता है जैसे जैसे उनकी समझ बढ़ती है बच्चे की, दूसरा रीजन इस जैसे जैसे उनका समझ बढ़ता है बच्चों का, उनके अंदर ये होता है कि वो अपनी मर्जी की चीज चाहते हैं, जिस तरह से दे ट्राई टू एक्सप्रेस व्हाट दे वांट एंड दे वांट थिंग्स देयर वे. सो उसके लिए वो टैंट्रम्स थोड़े बढ़ते हैं उस सिचुएशन में, बिकॉज नाउ द चाइल्ड इज अंडरस्टूड दैट देयर I can somewhere get things done my way also, according to my liking also. So यहाँ पे reinforcement method, motivation method बहुत काम कर सकता है कि जब बच्चा थोड़ा सा भी करता है तो आप उसको reinforce कर दो positively, not negatively. डांट के चिल्ला के थप्पड़ मार के आप क्यों नहीं कर रहे हो, ऐसे नहीं. आप positively reinforce करो. You can be firm that this is time to work and we cannot go and do anything else. You can be firm, consistent with your efforts, and give positive reinforcement even if he does it a little, so that he knows that I get all the attention, I get reinforcement when I am performing or doing, but when I'm not doing, I'm not getting anything. So this works sometimes very well and they get back, so they need to be motivated कि हम ये करते हैं, it will be fun, it will be this, it will be that. So ये उनके लिए fun create करना, happiness create around the activity that we are doing can help. And you can definitely ask your speech therapist to modify or change the ways or try some other targets. Maybe sometimes if you're working on a certain targets and the child is not performing in that target, you can pick up some other, drop those targets for few days and come back to them later. That's how you can do.
Alright, Vikas Chakravarti is asking, my child is 2 years 4 months and he says only mama, baba. Eye contact is very good. But we have done a big mistake. More screen time, when we understand the problem is screen time, we reduce up to uh, the per
Minimum.
minute.
Hmm.
Uh, Please suggest.
Okay. So, because your child is young, 2.4 years, I'm very glad that you understood that screen time is something which can really be a big barrier in their learning for the language acquisition and for their social interaction, because they're so much focused into the screen that they do not look around in the surrounding. They will not pay attention to what we are saying. They will not hear sounds which are routinely heard in a house, like कुकर का सीटी बजा, मम्मी ने आवाज दिया, घंटी बजा घर का, और साउंड है जो कि घर में लोगों के बात करने की साउंड, ये सब कान में जाना जरूरी है for language to develop. If the child is completely focused at the screen or the sound from the screen, the child is completely masked, and there's a big barrier to all these things which are happening in the immediate environment of the child. I'm glad you stopped that and you have modified the environment. You will find a lot of change with that modification also. But simultaneously, your child is at a young age, and starting early intervention can really help because you have time, and time is on the child's side. If you start early intervention, work with your child early on, you will find good positive results. So helping the child, starting with simple play based interventions, or occupational therapist can start forming a bond. Behavior modification, speech language, there are a lot of therapies. You can see a doctor first, and with the help of the doctor decide which therapy is required and which intervention is to be done to start with. And at home, what activities can be done. Take a home plan also. The parents need to work much more than what the interventionist would do, because you are going to be with the child all the time. So use the next 6 months to stimulate the child, enriching environment for the child, and you will find a change, I'm sure.
Swati Bhatia Munjal is asking, Hi ma'am, my son is going to enter third year. His ASD score is around 80. OT से काफी डेवलपमेंट ठीक हुआ है, आई कांटेक्ट भी आने लगा है, बट स्टिल स्पीच नहीं आया है. एंड पॉटी ट्रेनिंग कैसे स्टार्ट करूं? कभी कभी सबको पिंच भी करता है.
Yeah. So, hi Swati. Your child is on autism spectrum and on probably mild side as per what I can see in the score. And I'm glad that with therapy you are finding improvements in your child. That means the therapist is doing a good job. And when we are talking of speech and potty training, so for potty training, a child has to be ready somewhere, should be able to comprehend what we are saying. So maybe working a little more on with language and starting with a language therapist to and speech and language pathologist who can work on the sound production, receptive language. Lot of time what happens is that parents they say कि हमने speech therapy start किया 2 महीना हो गया अभी तक मेरा बच्चा कुछ बोला नहीं. So remember that the child is not going to instantly start talking. A speech language therapist will work first on the pre-linguistic skills, then OTs are also working on occupational therapists are also working on pre-linguistic, speech language therapists will work on pre-linguistic skills, and then they'll work on the receptive language. Receptive vocabulary increase होगा, बच्चे का समझ increase होगा, बाद में they'll start saying or speaking something. So it's a slow process. You need to start working now and work very consistently with the therapist. Take up all the activities home, do those activities at home also, and you will find your child responding and learning good habits. So we I think, are we done with the questions for today?
Just
We
take
have
a
a
few.
lot of questions in the chat box. Let's take
All right. Shivam Nagar is asking, my kid
one
is
last question.
experience
We can take.
Yeah, sure. Shivam Nagar is asking, my kid is experiencing impulsive episodes. He loves to jump a lot. He himself cannot control. Due to this, his attention is very poor. We are trying to make him sit, but he runs and jumps a lot. His age is 3.8 years.
Okay.
That's it.
So I believe you can enroll your child one for some therapy like occupational therapy where they can work on reducing the hyperactivity, increasing sitting tolerance. You can add up a physical sports for your child if you have, or you can make the child teach him some cycling activity, and at home also make him do certain physical activities, some exercises where the energy is consumed in the right way, like bat and ball activity, playing football, going to the park, playing football with him, or target hitting activities where the child is involved in a physical sports like activity where there is a task which has to be completed under instructions. It cannot be that the child is going to the park and is doing free play. वो भाग रहा है, जंप कर रहा है, घूम रहा है इधर उधर और आ गया, नहीं, उनके साथ किसी को खेलना है जिसमें there is an exchange happening. You are giving an instruction, pass on the ball to me and I'll throw the ball, now catch the ball, pass on the ball, or hit the ball with the bat, and throw the ball, hit the ball, these kind, or target hit करो. एक इंस्ट्रक्शन बेस्ड चैनल में बच्चे को फिजिकल एक्टिविटी कराना है. That will improve their executive functions, where they are listening to a command, where they are understanding the command, where they're executing the command, completely executing it to the fullest, and gradually their neuronal system sets into this pattern, and then they will listen to the commands. They'll start sitting also. Sitting tolerance will come gradually, but you need to work on that. Still, if the child is very disruptive, aggressive, you feel it's very difficult for you to manage, there are some medications which can be considered. You have to reach out to an expert who can help you with those. So those are the two ways that we can do. And I guess we have taken up some questions from the parents, and those whose questions are not being taken up, we will have a live question answer session again, and we'll take up all those questions again into our session. So stay tuned in for our next question answer session. And all those whose questions are incompletely answered or they have more questions, you can keep posting your questions. We'll pick them up and we'll try and answer as many as possible for you. Thank you so much for joining in, sending us your questions, interacting, viewing our sessions. I hope we are able to help you in our best possible way. Good night.